Mrs. T is a 70-year-old female who presents to the hospital with a chief complaint of heart palpitations. As she was watching TV, she said she felt that her heart is racing and that it is about to jump out of her chest. When she presented to the ER, EKG shows AFib. This is a new diagnosis. How would you manage this? Another very common admission to the hospital, atrial fibrillation. You're going to have a case of AFib tomorrow, guaranteed. So, first of all, keep in mind, patients with AFib with RVR could present with hemodynamic collapse. So their blood pressure could be very bad. Okay, these are the patients that you got to open your ACLS book and see what you need to do there, or that algorithm. In these cases, these patients need to be shocked, and what they do is synchronize cardioversion. So you need to put them back into normal sinus rhythm because this abnormal arrhythmia caused them to have hemodynamic collapse. So their blood pressure, let's say, is 80/50. Okay, these patients need to be shocked now. Okay, so other symptoms that these patients could present with hypotension, cold to touch, altered mental status, severe acute heart failure. These are all from the AFib. These are all patients that you want to shock now. So in AFib in general, studies have shown that controlling the patient's heart rate is as good as converting them back into normal sinus rhythm. So any patient who comes in with AFib, you don't have to think about shocking them or getting them back to normal sinus rhythm, because these patients can be in AFib and they would live a normal life and they would be fine. Okay, so rate control is as good as rhythm control in AFib and atrial flutter. So in patients who come in with AFib, so let's go back here to this scenario. So the patient here came in with AFib, and let's say her heart rate was 120, for example. What does the ER do? Again, ER does something, they call you, and you continue care. So a lot of times what the ER do is that they give the patient a bolus of diltiazem. And if that doesn't work, they give them another bolus. And if that doesn't work, they put them in a diltiazem drip, and then they call you. So the recommendation for the boluses are 0.25 milligram per kilogram, okay, over 2 minutes. So you give them a shot of that. And then if that doesn't work, then you wait 15 minutes and then you give them another bolus of 0.35 milligram per kilogram over 2 minutes. Now, about 25 milligram is the usual dose. Now,